Dr. Lanza, when you talk about hospitalizations, what's the availability of beds in our hospital now?
Right.
I know.
I'm glad you brought that up because I checked with, and I put it on my little sheet here, I checked with all three hospitals yesterday and today, and all are still green. We worked with Mayor Robinson on that green insignia for the hospitals, which means they're
You
not
may go
having
ahead and explain, because
insignia.
I'm familiar with the green,
Yeah,
but I
it's
don't
the
know if my
green,
colleagues
the
are.
yellow, and the red. Green hospitals are working fine. They have plenty of beds. They have plenty of acute care beds. They have plenty of ventilators. There's not a shortage. Yellow would be getting to the point where they're starting to worry about availability of acute care beds and generators. And then red, everything's filled up pretty much. It's green. It's pretty much always been green.
So it's just untrue, and I just want to make sure that we have complete clarification. It's untrue that there are only 3 ICU beds left at a particular hospital, right?
Well, if I may answer that.
Yep,
So
fine, no.
there's an ACA website you can go to. It's actually showing that there's 6. Now, were there 3 beds available last night? Yes, but we have a surge plan. We had, I think it was 330 beds available. You can turn a bed into an ICU bed.
Correct.
I think, if you want to say we're down to 3 ICU beds or 6 ICU,
Well,
how many do we normally have?
Exactly.
I mean, hospitals try to operate at capacity. There's usually a somewhat of a wait list. So I think the bigger question is how is this different than, say, a year ago?
Exactly.
Well, Commissioner, I don't, with all due respect, I don't think Commissioner May said that. I think Commissioner May was asking for what was said in the media. I don't think it was
right.
I don't think it was his statement.
No, I'm not saying it is. I'm saying I looked when I sat down and then we had 6 beds available in the county.
Right.
But I'm just saying for everyone else.
Right, I mean,
I
and
know
the
this, but
reason
I
I
said-
asked the question, because that was put out in
Right.
print, and so we need clarification.
And we had,
so if that is a misunderstanding, then that clarification should be conveyed to the general population, because the average citizen that I represent doesn't understand when they say that there's only 3 ICU beds.
And I believe there were some comments that may not have been highlighted as the title to the article was, but at least from Gay at HCA, that they normally operate at a very high percentage
Exactly.
utilization rate.
They have to
Historically, I mean, 90% or better. I mean, that's a normal thing. So, that's not like a lot of the things that get set up here or other places. I mean, some things make better headlines that don't actually have a lot of substance to them.
Right.
So,
Right.
So, I mean, we have over 150 ventilators available.
Yes.
That was something we were worried about before. And so I think and that's why the hospitals are still indicating a green status, because there's availability of beds, there's availability of ventilators, there's availability of supplies, which is all things they were worried about back in March.
And that's why the marketing and money is so important, Robert. I understand the yellow, the green, and the red because I'm on a weekly call. Staff that gets paid money who work in public safety, they understand this. The average person who works in community and their parents are in a nursing home, they don't understand that.
Yeah.
They don't understand when you read in the paper that it's only 3 beds that are available. That causes stress, that causes anxiety, that causes anticipation. And so we do have a responsibility to get the information out accurately. So you know how to go to Aqua, you're a county commissioner. The average citizen is not getting that information. So it's critical that we put out the information as factual as we know it.
And may I interject, please, for a second, because that's one of the discussion points that we had with our 3 presidents yesterday on my coffee. What people want to know when they see the media headlines and these salacious front page covers and things of this nature, they're thinking we're being overrun like Houston or like New York was a couple months ago. What we really need to see is, of the total available beds, broken out, how many are COVID patients and how many are non-COVID? Of the ICU beds, how many are COVID and what percentage, and how many are non-COVID and what percentage? We need that information broken out and put on a dashboard for citizens to see. Because if you rely on the media, they're going to play this up because that's how they make money. They like it to be a very, very, chaotic situation, and they like a lot of urgency. But I want clear data. And I asked that yesterday, and I didn't really get a good response. So I'm hoping, Janice, between what's out there, is that kind of information available somewhere so that the staff could go get it if the hospitals didn't want to provide it? Because that's important. We need to know that. I want to know. I asked them percentages. They said, well, we think 3%, 5%. They didn't give a good answer. Citizens want to know how many of these beds are being used by COVID patients. And like Robert said, how does that compare overall to last year? That's the kind of data that I'd like to see.
And Jeff, and I concur with you. I remember sitting here on this dais 2 months ago, and it's not that serious. Let's open up the beaches. Let's go. And all of a sudden, you know, we're better than anywhere in the state. All of a sudden, we have people wait in line to get tested 4 to 5 hours.
Sure.
The problem is we know that deaths and the critical part of this follows 3 to 5 weeks after people are tested positive. So, I mean, there's a lot of anticipation on people, not only if they get COVID, but if I break my leg, if I fall off a house, if I have a car. I mean, the hospital beds are taken, they're taken no matter what my ailment is. But we have a responsibility to report the truth.
Yeah.
And people can take it and receive it however they want to receive it. But it's up to us to make sure we get that information
But the
out.
truth has to be the truth. It can't be, well, look, we have no ICU beds left. Well, that's because we strangled the hospitals and told them they couldn't do any medical procedures that were non-emergency. And so they lost a lot of revenue. They had people laid off. I mean, so now they're back to doing heart transplants and things of this nature and these complex surgeries. And so, yes, some of the ICU beds are because of that being utilized. So,
And the good thing about it, we don't know the answer. And
that's why I want it broken down on a dashboard so we can see it.
Yeah.
How many ICU beds for COVID patients, how many beds for COVID patients, and how many are non-COVID? And let's end the hysteria and put the facts out there. That's what we need to see.
So Jeff, I did get an answer from one of the hospitals yesterday that less than 10% of their
Exactly.
ICU beds were COVID patients. I just checked the ACA website again. We do have 7 current beds available. Select Specialty has added a ICU bed. So right now, there are 7 beds available. And again, we have to look at how many of those are COVID.
But Robert, wouldn't you agree it would be great for the citizens to know? They see the news, they see people getting wheeled out on stretchers, people getting dumped into trailer morgues. Wouldn't it be great to know exactly what the real story is? I mean, I know it's a serious disease. It is a serious, but tell us the real story and give us all the facts. Don't show us videos of Houston or Arizona or New York and then try and conflate that with what's happening here. Dr. Lanza, the total number of hospitalizations, correct me if I'm wrong, that's from March forward. That's the total, the grand total, 95.
Correct.
From March forward. Okay.
And Jeff, for me, I'll err on the side of caution and safety at the advice of a healthcare
course. Me too.
official. I mean, we're
Me too.
politicians that make policies. We're not in a position to evaluate, to project, or to present data. I mean,
But we need the data
we
to
need
make
it,
our judgments.
and we need it from the experts. And
Correct.
then we can make a decision.
Yep.
I mean,
I agree.
I mean, we're politicians. I mean, we're not healthcare officials. I mean,
Absolutely.
Absolutely. And Dr. Lanza, you have more slides, correct? Okay. Commissioner Underhill?
Thank you very much. I'll make it short. The only redeeming factor of that article in the PNJ is how few people actually read it. I am absolutely with my peers with regard to it is our job to put out the data. And Dr. Lanza, we've been kind of, you and I have been kind of push and pull on that for quite a bit. I mean, there is the constantly reporting the number of cases is not the public policy rubber meets the road point. It is this. It is, do the hospitals have the ability to handle where we're at? It's the fact that the hospitals are reporting every day that they're green. That's what the citizens need to know. And especially in my neighborhoods of limited resources, people respond to fear. And when we have that kind of information out, the only reason that an article like that can be put out there is because we are failing to put out the data that we should be. So along the very same lines of the discussion about, there should be one click to find out where I can go and get a test today. It should be one click to find out that citizens can be reinforced that our hospital system is not overrun. And so that's not on you. The data sets are. I mean, I'm still, Janice, I'm still waiting 2 days later for filling in those data sets that from the state EOC that I asked for. We shouldn't have to wait that long. The citizens shouldn't have to wait that long. It should be at the touch of your, one or two clicks into myescambia.com, and that information should be available. So I hope that our staff is hearing loud and clear, because I didn't hear anybody say, no, let's put out less information. I think all 5 of us at one point or another in this conversation have said, let's do a better job of that. So I hope that we all take that for guidance, and I hope, Dr. Lanza, that your team and the team in Tallahassee can enable and empower our staff to do that for our citizens. Thank you.
So I do want to clarify that.
Ms. K, can I just say, respond to you?